Hello everyone, and welcome to today's podcast. My name is Karolina, and this is Endo Power Couple. I try to create a podcast that takes a holistic approach to endometriosis and adenomyosis. From my own experience, I know that this illness doesn't just impact women, it also affects their partners, family, and friends. I'm not medical professional, psychologist, or dietitian. Today we're going on an intriguing journey through the symptoms of endometriosis and adenomyosis, and we clear up some common misconceptions and explore ways to empower women on their health journeys. These conditions affect countless women, yet they often remain veiled beneath layers of silence and misconceptions. Endometriosis, but also adenomyosis, on the other hand, is a word that can raise many questions and concerns. It's a condition that impacts the lives of many women, but it's not always easy to grasp. Imagine your body as a big puzzle, sometimes in some really strange and surprising spots. There are puzzle pieces that aren't supposed to be there. Endometriosis is a long-term hormonal and immune-related condition. Normally, a tissue called endometrium is the inner lining of the uterus, but in endometriosis, this tissue is found in places outside the uterus too. It's often located in the abdomen, like the uterus, fallopian tubes, ovaries, bladder, and bowels. It can even show up unexpected spots like the liver, stomach, diaphragm, and sometimes even in the lungs, brain, or eye. One of the main signs of endometriosis is strong pain, especially around the time of your period. But if the condition goes on for a while, the pain can get worse and happen at other times too, not just during your period. This can make your life quite uncomfortable or even take your quality of life. Adenomyosis, on the other hand, is often called the sister of endometriosis. It's a significant but also frequently overlooked and even more often undiagnosed. Here's what's happened. Within the walls of the uterus, between its muscle fibers, little pockets develop similar to those found in endometriosis. These pockets cause long-term inflammation and disrupt the normal functioning of the uterine muscle. The main reason for this condition is the breakdown of the barrier that separates the regular lining of the uterus from the uterine muscle, allowing the endometrium to penetrate deep into the uterine walls. This usually occurs during prolonged inflammatory process or due to mechanical disruption, such as during certain medical procedures like scraping the uterine lining. The problem is that adenomyosis often gets overlooked, mainly because it can be challenging to diagnose. It requires the keen eye of an experienced ultrasound doctor, but it's crucial to understand that adenomyosis can significantly interfere with the implantation process. It does this by causing local inflammation, reducing the receptivity of the uterine lining, changing how the immune system responds to the uterine lining, and affecting the contraction activity of the uterine muscle. These factors can lead to difficulties in maintaining a pregnancy. Let's now discuss the symptoms of endometriosis, but also adenomyosis. In general, it's PMS, breast pain, migraines, brain fog, mood swings, anxiety, night sweats, feeling of coldness, tiredness, sciatic nerve, lower back pain, leg pain. From reproductive system, we have menstrual pain, ovulatory pain, irregular cycle, irregular bleeding, clots, pain during intercourse, infertility, heavy menstrual periods, endometrial discharge, dark brown before and during menstruation, pelvic infections, digestive system, painful bowel movements, diarrhea, constipation, nausea, vomiting, urinary system, frequent urination, painful urination, blood in urine or stool, chest pain, shallow breathing, rapid heartbeat, shoulder pain, lower abdomen pain and discomfort, pain while you lay down, dizziness, collapsed lung, bloody sputum. Additionally, we can have low blood sugar, low magnesium levels, low iron levels, low vitamin B and D. You probably notice that the list is pretty long, and the symptoms are so common that it can be tough to get the right medical attention, including a detailed diagnosis. It's important to know that some women have endometriosis or adenomyosis without feeling the usual pain. They might only find out about their condition when it's so more advanced, often by accident. So the key thing to remember is that every one of us has a one-of-a-kind body, and we totally have the right to make sure our concerns are taken seriously. And you know what? We also have the right, and we should totally insist on getting the right diagnosis, because we are not only standing up for ourselves, but also for our daughters and all those who come after us. Often in illness, we feel alone until we finally find the right doctor who understands us, guides us, and tries to improve our quality of life. It's tough for someone who doesn't have endometriosis to understand how hard it is and how it affects our daily lives. Endometriosis has been recognized as one of the top 20 most painful diseases. The pain is even compared to that of childbirth or what people with cancer go through. According to guidelines on endometriosis from the European Society of Human Reproduction and Embryology in 2022, 190 million women worldwide have endometriosis. When I check in England, endometriosis is the second most common gynecological condition in the UK, affecting 1.5 million women, which is about the same number of women affected by diabetes. In practice, this means that 1 in 10 women is affected, similar to counting your female friends on Facebook and or Instagram, then dividing that number by 10 to estimate how many women in your circle might have it. On average, it takes 7.5 years from the onset of symptoms to get a diagnosis. 4 years ago, the maximum diagnostic time was 4 years in my region. So, dear ladies and gentlemen, we know that in English healthcare system it takes much longer. You might have to wait a year for each appointment, and you are lucky if you get 1 appointment a year. Now, I have some questions on my mind. If endometriosis is as common as diabetes, why are we still suffering without help? Why haven't specialized endometriosis center offering comprehensive care been established? This isn't just a gynecological issue. Since hormones and women's health are so crucial for daily functioning, why do we have to wait a year for such a fundamental doctor as gynecologist? Besides women's health, there is also the possibility of having children. If we neglect such a crucial aspect of women's health, how can we expect women to want to have children when they don't have access to basic women's care and a consistent gynecologist like in European countries? Please don't misunderstand me. I know there are some endometriosis centers, but in practice, we as endo women still can feel safe when something is wrong or when we have questions or new problems. There is no way to speak with your endogynecologist. Imagine how difficult it is to find a good endo doctor, and when you have a problem, you need that exact doctor who understands that this illness, your case, and just you. We have to go to A&E and wait for hours in pain. And it's not only pain, because this illness occurs for example, bowels too. And we wait so many hours only to get undressed again and see a different doctor each time, which is not comfortable. How many times must we recount the entire story of pain when we feel powerless? In Europe, if you have a problem with something like thrush or painful sex, irregular cycle, I can go straight away to my good-known gynecologist in the same day if it's urgent, or up to 2 days. Now imagine how much easier will be and comfort that you go to your good-known doctor. However, I believe it's necessary to talk about it and demand better medical realities. We also have the right, and we should absolutely demand to receive the correct diagnosis, because we are not just advocating for ourselves, but also for our daughters and future generations. Okay, I tackled a heavy topic, and not the most pleasant realities. Let's debunk some common myths about endometriosis and adenomyosis. Myth number 1. Endometriosis and adenomyosis are the same things. While both conditions, presence of endometrial tissue inside the uterus, they are distinct. Endometriosis occurs when endometrial tissue grows outside the uterus, while adenomyosis involves the tissue growing inside the uterine wall. Myth number 2. Only older women can get these conditions. Endometriosis and adenomyosis can affect women of all ages, including teenagers and women in their 20s and 30s. Myth number 3. Endometriosis and adenomyosis are just bad period pain. These conditions can cause much more than just menstrual cramps. They often result in chronic pelvic pain, painful sex, and a range of other symptoms that can affect daily life. Endometriosis has been recognized as one of the 20 most painful diseases. The pain is even compared to that of childbirth, so please, don't say, "We can handle the pain." Myth number 4. Pregnancy cures endometriosis or adenomyosis. While some women may experience relief from symptoms during pregnancy, it's not a guaranteed cure. Symptoms can return after pregnancy. Myth number 5. These conditions only affect the reproductive system. Endometriosis and adenomyosis can impact other areas of the body, leading to symptoms like gastrointestinal issues and pain in other regions. There are cases where doctors find endometriosis in the lungs, eyes, or brain. Myth number 6. Hysterectomy is the only treatment for these conditions. Hysterectomy isn't a cure due to the fact that endometriosis spreads not only in the reproductive organs. Removing the uterus won't be a solution. Regarding adenomyosis, my doctor told me that they perform surgeries to remove adenomyosis, but only when it's above 14 millimeters. This is a several-hour-long operation burdened with very high risk. It's a very personal decision, and it's not just about the issue of having children, but also about the quality of life. The uterus is an organ that we remove. You can always explore various forums and ask people about their practical experience with such a decision. I don't want to give my private opinion here, but I just say this. When I don't know, I read medical books or biology one. I look at the diagrams of our bodies, I think, analyze and search for an answer that resonates with myself. Myth number 7. All women with endometriosis or adenomyosis are infertile. While these conditions can affect fertility, many women with them can still conceive and have healthy pregnancies with the right doctors and care. In the next episode, we're gonna discuss what an endo appointment should entail, what the doctor can observe, and what the new diagnostic standard is. I want to keep this podcast brief, lasting a maximum of 20 minutes. You can listen to it during a walk, while driving to school, work, or home. Remember, knowledge empowers us, and together we can navigate the challenges and the doubts that arise because of this condition. Until our next episode, take care and keep advocating for your health and well-being. Don't forget to visit our Instagram, Endo Power Couple, and DM us for freebie. Stay tuned, Karolina.